Hello, my name is Alvaro Alonso-Garbayo. I'm a research associate at the Liverpool School of Tropical Medicine, and I'm working on health systems in fragile settings for the last 25 years. I started as a humanitarian worker, then as a consultant, and then I joined the school 4 years ago, and since then I've been doing mostly research on health workforce issues. I'm introducing you to this study that is a collaboration between the Liverpool School of Tropical Medicine and the National University of Timor Leste. It's a study that explores the human resource for health recruitment and deployment policies, processes and practices, and their impact on the effective coverage of the health workforce. This is a case study, as I said, focused on Timor Leste's public health system. And it focused on Timor Leste because Timor Leste was in a conflict with Indonesia for 24 years during their illegal occupation, after 450 years of colonial domination by Portugal and only 7 days of proclaimed independence in between. It's a retrospective, qualitative study with some qualitative elements, which covers a period from 1999, after the resolution of the conflict, until the end of 2017, although we have looked at some aspects before the resolution of the conflict and after the end of 2017, because there are some very recent events that are important to the study. It uses a labor market framework to analyze the different elements influencing the workforce development. It takes a political economy perspective, looking at how individuals and organizations behave, looking to the decisions they make, and looking to the actions they take and the relevant factors in the context in which all those actions take place. The main objectives of the study is to analyze first the evolution of the human resource for health recruitment and deployment policies and process since 1999. Again, we took also some of policies and decisions made before because it was important to understand what came after that, until the end of 2017. And again, we have included some policies and decisions made after that. Then we assess the implementation of those policies and those decisions, and then we understand the impact that all those decisions and all those changes in those decisions had on processes, practices, and achieving an effective health workforce. And finally, we provide recommendations. Based on that evidence, we provide recommendations on how to strengthen recruitment and deployment of human resources for health in Timor, but it will have an impact and it will be useful also for other contexts. Regarding the methodology we have used, we have first done, basically what we have done is what is called a system mapping, which is to know the system of recruitment and deployment, a system audit to understand how is that working, and a system impact, which is how all that is impacting on the workforce system. The methods used, first we did a literature review about what is the existing knowledge about the topic globally and focused also on post-conflict settings. We have done a thorough public administration document review, looking to documents, and this is when we speak about policies here, is not just formal policies. It could be decisions, it could be documents that we find like in newspapers, speeches given by politicians, intentions of stakeholders expressed in different media. So we have done a document review about that, and then we have been talking to those key informants, including all important people, all key decision makers during the whole period. So we have interviewed people from international NGOs that came immediately after the conflict resolution during the humanitarian intervention. We have been talking to bilateral and multilateral agencies like WHO. We have been talking to government institutions, obviously. And here, the important is that we haven't focused only on the Ministry of Health. Workforce is a multi-sectorial issue that requires consulting different institutions. We have been in touch with the Public Service Commission, we have been in touch with the Ministry of Education, we have been in touch with the Ministry of Finance, we have been in touch with the University of Timor Leste, our counterparts, but also other private universities in Timor. So we interviewed all these people, and then in order to understand how those decisions made by those people or influenced by those people were implemented, we went to the districts in Timor, and we selected 3 districts. One is a very, very remote district, the most remote district probably in Timor. We took the capital district, which is a urban district with a complete different setting, and we took a district which is middle way from between rural urban setting. And we have been talking there to health workers, frontline health workers, mainly doctors, nurses, and midwives. And we have been also talking to their managers to see how those policies and those decisions are implemented at district level. When we talked to them, we also took a retrospective lens. So we have been asking them about the moment that we were doing the interview, but we were also asking them for their experiences since they joined the workforce or since they were involved in the health sector in Timor. And finally, we have been collecting some quantitative data to understand what is the availability, but not only the availability of health workers, but also the accessibility, how accessible are them to the population, their acceptability in terms of gender, ethnic composition, etc., and the quality of those workers. At the moment, the situation of the study is that the literature review and the public administration document review is completed. The data, the qualitative data collection is completed. We are still collecting some quantitative data, and we have already started with the analysis and the writing up of the different outputs of the projects. Why is this project important, and to whom? This project is basically very important because it's dealing with the most important element of the health system, which is people, is the human resources for health. It's important because we expect that the evidence in the right hands will improve the availability, accessibility, acceptability, and the quality of the human resources for the Timorese people. So they will be more accessible, more available, more acceptable, and of better quality, providing services to the Timorese people. This evidence can also be useful in similar situations and settings. It may help different actors to intervene more effectively. For instance, it can be used, the framework that we will develop can be used in needs assessment after conflict. It can increase returns of donors on government investments in the workforce, etc. The results of the study will also support the implementation of the current National Human Resource Plan, Human Resources for Health Plan, which is completed at the moment, is pending on approval, so it's about to be implemented. So we hope that the evidence will be able to support the implementation of this plan. Obviously, in general, that will lead to have a more equitable and effective health workforce in Timor. It will also help to support the implementation of the WHO Global Health Workforce Strategy, as we are testing some of their hypotheses and we are supporting some of the main pillars like strengthening management of the health workforce. And we are also testing a new framework that is being used by WHO, which is the Thanahasi framework. It's an old framework used for health service coverage that is now adapted for health workforce. The project is expected to be completed by the end of 2018, when this phase of rebuild will be over.